Well, hello everybody. I'm so happy that you tuned in to our wonderful show. We're at the Rogers Studio in Miramichi for Have a Chat. I'm your host for today's show, Judy Loge, joined by my lovely friend and co-host, Veronique Arsenault.
So happy, Judy, to be here with you as always.
She's my bestie. And we have this fine gentleman who is new to the show and is going to bring us a wealth of information, and he's just a charming individual. We're blessed to have him on the river, and he's going to tell us more about his background. Welcome, Dr. Nir Shoham-Hazon.
Thank you very much. Thank you, Judy.
We're so pleased to have you.
Very well-trained ophthalmologist, and we're going to learn more about that specialty. But in the meantime, welcome, and tell us all about yourself on a personal level, where you grew up and about your family and coming to Miramichi and your children.
Okay, thank you. Thank you both for having me. So, as you said, my name is Nir Shoham-Hazon or Hazon. I'm originally from Israel, born in Israel, lived a bit in the U.S. as well. My dad was a diplomat. I'm married to my husband Effie, and we've got two young kids, 8 and 10, Liam and Jordan.
Nice.
And we've been here in Miramichi for since 2017.
Okay, I was wondering about that when you arrived.
And we've loved ever since we stepped onto the river, and we don't want to go anywhere. So it's
well, I'm glad to hear that. You know, it is something when you come from a big city. Where were you in the States, Doctor? Where did you live?
In Maryland, the East
Okay,
Coast.
so that's big.
And yeah, it is a big, but and oftentimes people say Miramichi, New Brunswick,
Right.
and we're like, yes, Miramichi, New Brunswick. We love it here. We knew where we were going. We knew we were going into a smaller town.
Yes.
And having two small kids, I think this is the place to raise a family, and definitely hearing about the good things that come out of Miramichi, we definitely feel secure and know that this is the future of our family.
You're happy. That
Very
makes
much.
us happy too, to know that you and your husband and children are here to stay.
Yeah.
Wonderful.
I love it, especially, being on council in my other hat. I always ask the question, why Miramichi? Because I want to know what can we do, what can we continue to do, and what can we do better, right? And I love hearing the reasons why people have come to the area. So, and we're so glad to have you. So, for those who aren't quite sure, and I'll include myself in that, what is the difference between an ophthalmologist and an optometrist?
Lovely question. And it's confusing sometimes even for me when I tell patients, when did you last have an eye exam? So they're never sure if they saw their eye doctor or eye physician. So it's a great question. So an optometrist is basically an eye care provider, an eye doctor that had undergrad in the sciences and then grad school doing optometry, doctor of optometry. And what optometrists do is they do your routine eye exams. They can fit you with glasses, contact lenses. Nowadays, optometrists also diagnose eye diseases, treat some of them, and if it's beyond their scope, they would refer to an ophthalmologist.
Oh, right.
An ophthalmologist go through again an undergrad and grad school, which is medical school. After medical school, they actually have another specialty. So it's anywhere between 3 and 5 years extra of specializing in diseases and surgeries of the eyes.
Very
So it's a collaborative model working together with optometry. We're very fortunate on the river to have amazing group of optometrists, but in general in New Brunswick, our center has great collaborations with different optometrists in the region, and it kind of takes a village. So it's not a one-man show, so we have to collaborate.
But you did clarify that very well. People did not know, and I'm included in that. I mean, I had a general idea, but you just made it really clear. So when did you decide to pursue a career in ophthalmology? And tell us maybe, you talked about what it entails as far as you get your medical degree, then you choose to go into that. But the actual training part of it, and where you went to school, right up to currently your specialties.
So actually, in medical school, I wasn't exposed too much to ophthalmology, so that was not my passion originally. When I graduated medical school, I wanted to do something totally different. It was still surgery, and I kind of stumbled across ophthalmology by chance, and I absolutely loved it, and I still love it every day I go into the office. And I just saw the research in it, the advances and the progress that can be made during one's career, for example, and the surgery. Surgeries are usually fine and delicate and hopefully bloodless. So that really appealed to me.
Interesting.
I admire
Yeah.
you because one thing I could not do, and I'll be perfectly honest and not lie to you, I cannot handle being around someone's eyes. Like if someone says, "Oh, is there something in my eye?" and I'm trying to look at it, it kind of freaks me right out.
Oh, really?
And you do surgery,
And
like,
and most of our surgeries are actually done under local anesthetic or freezing, so patients are awake. So you have to be doing surgery
Yeah.
on someone's eye when they're awake. So
Yes.
you kind of have to have a certain maybe tone and demeanor
Yeah.
about you to be able to do that in a calm and safe atmosphere.
you also do something that nobody else does, and you can tell me the proximity within, if it's this province
Yes.
that you do it on, or
Yes. So
But
yeah, I'm a glaucoma and advanced anterior segment surgeon. I'm actually the
goodness.
only one. Yeah, it's a mouthful. So I'm the only one in the province who does glaucoma surgery.
Oh.
I did a 3-year fellowship at the University of Toronto after my specialization. And that was another reason we wanted to come to New Brunswick, because at the time there was no one that had that specialization. And I
amazing.
did want to be able to offer something unique to a unique
Yes.
location.
That's incredible.
That's incredible.
Yes.
It is. I just
Yeah.
echoed that. That's incredible.
No, it is.
So you have, though, something wonderful and new
Yeah.
here in our area, and we're so thrilled to have this. But you've just opened a new clinic on our Water Street or waterfront, so right downtown Miramichi East or Chatham. And tell us a little bit about that your vision of that, how you got to getting it to becoming true, and everything that you all offer there.
So back even before the pandemic broke out, I had a vision that I wanted to have a center. We on the river are highly specialized, so we're 5 ophthalmologists. Each of us has its own very unique subspecialty. We have a cornea specialist and Dr. Lichtinger. We have a pediatric and neuro-ophthalmologist, so someone that deals with kids and diseases of the nerve, Dr.
wow.
Winter. We have our senior, not so senior, Dr. Sharma, who everyone loves and adores.
I did
and
both of my parents'
Yes,
cataract
he's-
surgeries.
He's
Yeah.
lovely. So he
Yeah.
has an interest in pediatric and ophthalmology. And we also have Dr. Zomer, who's an oculoplastic surgeon.
Yes.
So next to Halifax, we're the most highly subspecialized area in
That's
the
incredible.
province.
How fortunate are we in
I know.
Miramichi to have that?
And we do have patients coming from all over the province to get care here. And back in the older office, there wasn't enough space to grow. And my vision has always been progress and innovation.
Yes.
So there came the vision of having something a little broader and bigger that could house all the specialists or most of the specialists, because one of us still works in her own independent practice.
Okay.
Just to have everything in one house, have kind of a Zen environment that you go into, a newer office.
Beautiful.
And patients do come in and feel that they're coming into a slightly different atmosphere, something that's, again, new and more relaxed.
Calming.
Very calming, yes.
And you said off the set that you're so pleased with the morale and the personalities that are so harmonious. And there's not, when you have an office, and I've worked in them, where there's just that underlying a terrible morale,
Absolutely.
it sets the tone, and it can really make or break, how people work together, and in a positive or not a positive way. So you offer that as well. The eyes are such a vital organ. Tell us why they're so important, because not everybody looks after their eyes, but they're
No.
my favorite feature. I value them. I treasure them. Of all the things I
Absolutely.
have, it's my eye.
So it is often referred to as the window to the soul. So we can diagnose a lot of different disease through the eyes. And we oftentimes, a patient comes in for a routine eye exam, and we actually are able to sometimes diagnose diabetes or hypertension or high blood pressure through the eyes. Sometimes you can diagnose different inflammatory processes, again, through the eyes. But The eyes are important. We do everything with our eyes these days. Everything is required, and sometimes we forget and neglect eye care a bit.
Exactly.
We go to our dentists to get our teeth cleaned and checked on an annual basis, but our eyes, sometimes we don't.
Take it for granted.
We do, and sometimes if you go, maybe it might be, a little too late. So
Yeah.
maintaining an early diagnosis of any eye disease can help longevity of our eyesight.
Yeah. Just a question while we're talking, Dr. Shoham. The floaters that I get, I've had them for years. Like I said, I could be in a room where the walls are beige and they're very noticeable, and it's like, oh, look at those, I have little black spots chasing around the room. Other times I'm so preoccupied, or there's so many other colors to distract me that I don't even know they're there, but they're there. What are they?
So floaters are basically changes in the gel of the eye. So the consistency of the eye, or the part inside the eye behind our lens, in the back close to the retina, has a gel-like form. With different eye structure, with age,
Say that again, with age.
with age, our gel breaks down. So it doesn't have to be an age-related thing. Sometimes patients, for example, that are nearsighted have longer eyes, and then the gel tends to break down. And then we see those floaters. But those floaters sometimes are warning signs that something's going on in the retina. So then it can be a sign of maybe a tear or a break in the retina. So if someone has new onset floaters, or we say flashes of light, it is warranted to go see an eye care professional, and it can definitely be an optometrist initially, and then if need be, referred to an ophthalmologist. If it happens, for example, over a weekend, sometimes if it doesn't resolve, may require even going to the emergency to get an eye exam, and sometimes an ophthalmologist will actually come in and see you on an urgent basis if need be.
Interesting. I've had these for years. This is nothing new for me. So,
No,
like
me
you said,
either,
it was a
And I have them too.
Yeah.
So do I.
Yeah, it's just a jelly head. I had.
It's a jelly. It's a sort of jelly, not jelly head.
Interesting. I just little side story, because I always credit the fact that Mom had her second cataract surgery with Dr. Sharma for the fact that we've had a lot more years with her because of her heart surgery, because it was the nurse that was prepping her for her surgery who noticed the irregularity in her heartbeat, and who then alerted the doctors. They did a lot of tests and then sent her to St. John. And so I always credit that cataract surgery actually because Mom's heart only had 38%
Wow.
functionality at that point, right? Which we had no idea. So, side note. Anyway.
And it is important, because when you do, and I've diagnosed quite a few patients with heart disease, just when they came to do a cataract under local anesthesia, you just put the pulse oximeter, and all of a sudden you hear the heart, or you see the heart rhythm. So exams, or routine exams, are really critical. Yes.
I'm so thankful for that, and Dad's cataracts were amazing. So, but talk to us a little bit about some eye conditions that we should really start thinking about, or that we should be aware of. And we hear so many different, especially in our older generation, macular degeneration, and all these things that sound terrifying. But talk to us about some of those, and what we should be looking for in obvious symptoms.
Great question. So I think, first of all, family history is really important. So if you have a family history, for example, of age-related macular degeneration, or perhaps early cataracts or glaucoma, again, it warrants getting your eyes checked. So age-related macular degeneration per se is typical after age 50. So per definition, may be diagnosed or treated after age 50. And that is when vision is not as clear as it used to be. We start seeing squiggly lines. So again, optometrists or ophthalmologists will help with that. Something to help prevent that is, one, early diagnosis, but also proper nutrition, sometimes extra vitamins. There are vitamins for age-related macular degeneration, so that is key. Cataracts, if we all live long enough, we'll get them.
Yes.
So that's a fairly easy, reversible cause of blindness. Glaucoma is an irreversible cause. So glaucoma is characterized by high pressure in the eye, which damages the retina and optic nerve and can constrict your visual field. It's often referred to as the silent thief of sight because you don't really know that you have high pressure. Rarely is it painful. Again, going to your eye care professional, it can be diagnosed. Again, if you have a family history, then early diagnosis is key. And again, family history is a very strong risk factor for any disease. And diabetes, we are plagued a little bit with diabetes in New Brunswick and maybe particularly up north. So getting an early eye exam is really, really key in helping to diagnose. Even if, because the eye, again, is kind of the window to the soul, we do see through the eye maybe how different organs are doing with the body. So it is important to get an early eye exam.
Incredible.
You talked we don't have much time before we go to break, but we're going to bring you back again. I think I spoke to you off air about having every now and then what they call episcleritis. What exactly is that when my eye gets red and irritated? Just is it something in my body that's producing my eye to flare up?
So sometimes we get inflammatory processes happening in our eyes, which again might reflect something on the body. So episcleritis or scleritis are inflammatory processes that come out sometimes in relation to other maybe arthritic or arthritic processes in our bodies. So again, having a routine eye exam can help maybe sending you perhaps to a rheumatologist to get a rheumatological workup. And sometimes it's the other way around. A rheumatologist or a different specialist will send patients to us saying, there is this past medical history of rheumatoid arthritis, for example. Are there any ocular or eye manifestations? So,
but it's just the one eye.
Still can be. So I kind of say the eyes are very separate. One eye is totally separate, still in the same body. It is, and they react.
I'm not doubting you. I'm fascinated by that.
and sometimes it's like we see a presentation of one eye and then nothing in the other, and it's like, really, it's the same body. How does that work? But one eye sometimes has more predisposition to disease than other.
I know. I'm just so happy. Like I said, we're going to go to break, but I just want to say again, with your knowledge, I hope that people are listening to Dr. Shoham and taking the eyes as seriously as they should be taken, just with our teeth and our ears. Eyes are of vital importance. So we're going to be right back. Don't go too far. We're going to be back with Dr. Shoham-Hazon very shortly. Thank you. Welcome back for our last segment of Have a Chat. We are so happy that you could join us. I'm your host for today's show, Judy Loge, with my lovely co-host, Veronique Arsenault.
So glad to be here.
And we're happy to be back again. We've been having a wonderful, informative conversation with Dr. Shoham-Hazon, if I'm saying that correctly. And he looks charming, and he is charming, but he's also full of a lot of interesting facts in his career as an ophthalmologist specialist. So, Dr. Shoham, we know that no 2 days are the same for any one of us. But as a specialist in ophthalmology, what would a typical day be for you on a Monday morning? Just you walk in your office, and I know you have your schedule of patients, but what would that entail?
So no 2 days actually look the same. So I know that I can come in the morning, and I'm not really sure when I'll leave in the afternoon and where I'm heading after clinic. So just being highly subspecialized, all of us get referrals from the entire province again. So you might get an urgent referral during the day, and you have to take the patient sometimes to surgery in the afternoon. So when patients come and see us, naturally they're a little kind of worried because they've been sent by sometimes a specialist, sometimes an optometrist, to see sometimes the big eyes. And when they come in, what they usually expect is to meet a very friendly crowd. So our staff are very diverse from all around the world.
Lovely.
Very, very, very hospitable. Very nice team, very calming. And if need be, that we do all our special diagnostic tests that you get usually at an ophthalmologist or an optometrist office. They can get a visual field test to see how their nerve works. We get different scans of the back of the eye and photos. We do have cutting edge technology in the office, and it's kind of all in one. You come in and we kind of put you through all the different diagnostic tests that is necessary. It is very, but
It would be, yes.
For me, it is because I'm a weird one with the eyes. I just, someone touched my eye, for example. I'm just a little phobic of it.
totally agree. But patients, and we often hear that, love coming to the office because it is welcoming, because the staff are kind of very timid and gentle, and they appreciate that, patients might get sometimes not the best of news. So it is a different atmosphere. So starting the morning with seeing patients may wind up going to the operating room to do either an urgent pressure relief glaucoma surgery, or sometimes a patient's lens gets dislocated and you have to do something about that.
Yes.
So no 2 days look the same, and I'm fortunate to have a good support system, definitely in the office, but also at home. So my husband takes care of the kids. He works in the office, so he's an ophthalmic technician as well. But I know I can have someone to take care of the back end of my life, which is the front end, because it's the kids and our future. But I can focus, and I'm allowed to focus on my patient, knowing that someone's focusing on the family, and that is key.
And that is so
key.
important to know that your boys, they're not babies, but they're always going to be your babies, are being well looked after by someone that loves them as much as you do. What I'm asking, I guess there's no such thing as a stupid question, but what exactly is a detached retina, and what happens if I have that? What am I going to experience?
Very good question. So detached retina is a result of some typically tear or break in the retina. We talked about floaters before.
Yes.
So not every floater means a detached retina, but patients, for example, that are nearsighted, for example, wear glasses to actually see for distance. So it's a little
I know, I always get
oxymoron.
confused. Yeah, I
Yes,
always
it's
get
a little
confused by that.
confusing. So the nearsighted don't see well for distance,
Right.
and vice versa. They have thinner retinas. Sometimes those retinas tend to break or tear. If you have a break in the retina and fluid gets under the retina, you can have a retinal detachment. If caught early enough, it can be lasered in our offices. We, all ophthalmologists in Miramichi, have a laser machine for that purpose.
Wonderful.
Yes, it's a great service and can be stopped at that. Sometimes when the retina detaches more extensively, at the moment patients actually have to be treated surgically, and at the moment it is only in Halifax.
And where exactly is the retina located? In behind the pupil? Or?
It's behind the pupil, behind the lens. It's kind of, I call it the film of the camera.
Okay.
So it engulfs the back part of the eye.
Right.
Wow.
Okay.
That's fascinating.
I know, it's all interesting.
Well, and and I think probably some of that apprehension when patients come in is the eyes are so critical, right? We don't think that they can also showcase what's going on in the rest of the body. You just think, oh my goodness, I need to be able to see. And when I was a child, I was about 7. We had an accident. I was out with Dad, and I got a face full of gasoline.
Oh.
Right into the eyes. Yeah, I was helping Dad pump gas, and it flew back and just filled. Very thankfully, we were near an eye wash station, and so we were able to, and no effects from it. But so I'm always so conscious of my eyes because of that. And I have astigmatism. So talk to us a little bit about what that big word means and what it means. Like, because for a long time I couldn't get contacts, and now of course I can wear them. But why is all that complicated?
So astigmatism is when the front part of the eye, which is the cornea, is not round, I usually say, as a soccer ball, but more oval, like a football. I do this conversation a lot in my office because when the time comes, for example, for cataract surgery, that can be changed with a lens. When you're younger and you don't need cataract surgery, glasses can change or fix your astigmatism. What the astigmatism basically does is it causes the break of the light entering your eye to kind of break or refract in not a straight way, and then you don't see focused well. So your focus is off. If you correct astigmatism, your focus will be better. So of course, when you get contacts and when you get glasses, we correct astigmatism in them. We now have astigmatism correcting lenses that we can implant during cataract surgery, and that again improves your focus. So it's not a must, but if you want to have better, more focused vision, of course with glasses and contacts, you want to correct your astigmatism. So that is the soccer ball and an oval.
Very interesting.
And it's genetic too. So if our parents had it, it can manifest in us as well.
Yeah, and Dad had cataracts in his 40s, and so that's why I do often get checked as well, because I worry that that's coming for me. And he's a very, very healthy individual, and so it's one of those things that I'm always concerned about. Both my parents had cataract surgery very successfully, but I'm always worried about what that's going to do to me.
The nice thing about cataract surgery, though, so patients come in and they're awfully very worried, oh, I'm going to have surgery. One of the benefits is that sometimes you can get rid of your glasses altogether. So patients that have worn glasses since grade school.
And that's what happened to Dad.
Yes, all of a sudden don't need glasses. So in a way, it's a sort of a refractive procedure. And patients love the outcome. It's a 20-minute procedure, but the outcomes are lovely. So,
Doctor, do you, for example, if I went in and had, maybe it wouldn't be the primary site for a cancer, but perhaps it has been presented with a tumor behind the eye, you would see that right away, even though that might not be where this is stemming from. Do you do that type of surgery, or do you refer for a tumor?
So we have to refer. So if we see tumors in the eye, it can be a primary tumor in the eye, but it can also be a secondary.
Exactly.
And we can, on a dilated eye exam, we can diagnose either primary or secondary tumors. They have to be referred out. So they do have to be referred out for surgery. It is still Toronto.
Oh my.
But for example, if there's a brain tumor, God forbid, sometimes we do see swollen nerves. So indeed, an eye exam can go a long way and can help, again, diagnose a lot of mysterious things that are happening in the body. So again, an optometrist or an ophthalmology exam, sometimes annually, is really critical.
And there's no easy way of breaking that news. So as a doctor, you know, as an ophthalmologist, is to sit that patient down who would be terrified then to know that, you know, this is what I have and this is what I have to get done. It's, it's overwhelming at times, but you would be the best person, I think, to break that news gently, because it has to be out there.
It has to, and I think part of our profession is compassion,
Oh,
and I
definitely.
think we have to put ourselves sometimes, although it's transference and counter-transference, we shouldn't put ourselves in our patient's position, but I think that is one way of showing our compassion and being more compassionate, because if you're able to receive the news, or you want to hear it in a certain way, I think that is, you'll deliver it
Not
in a better way.
Yeah.
Exactly.
Do patients have to be referred to you?
Yeah, it's a very good question. So indeed, for an eye specialist, either an optometrist can refer patients to us, family doctor or nurse practitioner. So we have to have a referral. And it helps streamline the process too, because if we know the reason and we have naturally lots of referrals, we'll know which specialist would be best fit to see the patient. So that's another reason why
Very good.
a referral is needed.
Very beautiful guest, because there's no hesitation on any of these questions. But I did have a question that's kind of off of the topic of ophthalmology, and that is, having known you for a little bit now personally, I want to know what you're most proud of individually and as a professional.
So individually, for sure, is having a family. I think one of the first concerns as coming out as gay, the concern is, oh, you're not going to have kids. And it's no longer an issue. One is because society, to the most part, accepts it, and there are so many different ways of having kids these days.
Of course.
We chose the surrogacy route, which we had, you know, an egg donor and a surrogate, and we did that process. And we did it in Canada.
Yes.
And we feel very fortunate. So on a personal level, definitely having a family with the next generation is what I'm personally very, very proud of. And just seeing the kids grow and mature
They're
and
good
learn.
boys.
They're amazing.
They are. Like
They're
what I know of them,
amazing.
I mean, he
Yes.
knows for sure very, very well what they're all
Yeah.
about. But when I've met them, they're just charming and delightful, smart, inquisitive kids, and you should be very proud of that.
Thank you.
Yes,
thank
and
you.
of your husband Effie too. He's dynamic and he's personable. And he's fun, and he's my kind of person, and you are too.
Effie
to be
has
around.
a lot of energy,
Yes,
and he's,
positive.
although I always say he's a little older than me, he's definitely the younger one in the relationship. So
Okay.
he's very energetic,
Yes.
and he can follow the kids where
Good,
I
good.
sometimes lag behind.
You get a little
he
tired, eh?
Oh, definitely.
Yeah.
So definitely kudos to Effie. He's doing
Yes,
a
kudos.
fabulous job.
And when it comes to your profession, you've been in this so long and you're advancing so, you're so fast forward in everything that you're doing. What are you the most proud of? Is it your new clinic? Is it having been trained so well to be where you are at today?
I'm very proud that, first of all, I'm allowed to service our community in Miramichi. We're very fortunate to have an amazing community that welcomed us personally from day one. So we came from Israel, and we were kind of a unique family, so to speak,
Yeah.
and we didn't feel that. We felt that we were very accepted, and it was just a great feeling to be part of the community and being able to have the kind of background and training that I have and be able to provide the service to the community is really unique. So
And rewarding.
And rewarding, and
Yes.
patients appreciate. And I think that's what we're looking for the most. You want your community, you want your patients to be happy, to be
Yes.
able to, thank you for the great service that we provided and we got. And I think that is probably the best accomplishment that anyone
And my
anyone
husband
can
speaks
have.
very highly
Thank
of you.
you, thank
Being
you.
a physician, he knows, very the best when he sees the best,
Yes.
and he says just the best. So.
He's lovely to work with.
Well, that's awesome. Great. we
Yeah,
have a
we-
whole lot of time.
We like having him in my family.
we have about 2 minutes left.
Okay, yeah. So when you think about, people out there, what do you want them to know most?
Yeah.
As we discussed, prevention is key. So getting routine eye exams and going and taking care of your body both physically and mentally is helpful in the long run to all of us. So we mentioned nutrition and exercise are key for our body in general, for our general
It's
health,
true.
and for our eye health as well. So whether it's routine eye exams or going to the gym or eating healthy. I know we said we like some fries, which is
Oh,
which
that's
is
just what I happen
great.
to love, but I don't
Which is-
eat them much because I
and-
know what it would do to me, the cholesterol.
But we have to indulge. We have
Yes.
to live
Once in a
life
while.
once in a while.
Of course
Absolutely.
we do.
Absolutely.
But at the same time, have a certain balance, and I
Exactly.
think that's what life is all about. And
Fruits, greens
Fruit.
would be very helpful. Like, is there certain things that are good? Is it vitamin K for your eye?
Is it true that carrots are good for your vision?
Yeah,
carrots have vitamin, so they do have vitamin A and carotene,
Yes.
and it is in our age-related macular degeneration vitamin. So that's important, but you're gonna have to have a whole lot of carrots
I
in
hate
order for
carrots. I
it
love
to
them.
get
I hate
to your
carrots.
eyes and to have that effect.
hate
But I
them.
think a well-rounded nutrition of proteins,
Yes.
carbs, grains, is really key, and naturally fruit and vegetables
Because
are
everything you
important.
do affects every organ in your body.
Well, you don't think of it that way, for
Exactly.
sure.
Your gut can
Yes.
affect everything. Your gut bacteria, and it's all
Exactly,
of that.
exactly.
Dr. Shoham, we're just about to depart from the show, but any last words to our viewers, just in general about, again, you said you love it here, but any last words to our Miramichiers?
So I want to say, come to the Miramichi. We are
Yeah?
looking
Yes.
for a bigger community. We love our community. We need doctors, nurses,
Absolutely.
and it is a great place to raise a family, to raise kids.
It is.
And we're very fortunate. We feel very fortunate to be here.
I'm so fortunate to have had you on the
Yes.
show today.
Thank
Absolutely.
you.
And I mean, we've had some burning questions, and some of them are silly questions, you know, but like I said, I mentioned my one eye irritates me every now and then. But it's been beautiful having you. We hope that you continue to service everybody and make them as happy as you've made the patients I've talked to.
Thank you
So
very
thank
much.
you, Dr. Shoham, Veronique, and to our viewers. Have a lovely week. Stay healthy, be well, and be kind to everybody you see out there. Bye for now.